Hello, this is Dr. B again, and I'm back to talk to you about your back and why is that important with regards to lithium. Well, very simply put, guess what? Lithium can take care of your back pain. Now, going back to medical school, going back to my residency training, there was not any time spent, no time spent in the treatment of back pain, except that we were told to watch out for herniated discs and arthritis and so on. But when you actually go to the practice day to day of taking people in primary care with back pain, guess what? No, most people do not have, arthritis. Well, we all have arthritis, but it's not the cause of the back pain. And some people got herniated discs, of course, that's a different story. But the majority do not have these problems. So you're left treating people just repeating what you've been told, but really not understanding what is going on. I didn't like that. I didn't like that at all because my patients didn't get better. And I don't like that. So anyway, that's when I decided to try to find out something more. Somewhere. I went to a local university medical bookstore. I started looking around to see if I could find anything. This is what I found. These books written by a very famous doctor and doctors, a couple of doctors, but especially this woman doctor, who was the private physician of President John F. Kennedy. She lived to be 90 years old, and up until the time she lived, all her life, she spent all her life studying back pain and muscle pain. And these are very important books. But guess what? Doctors are never told that they exist. Amazing why they're not talked about them. But there, at least, and these charts that I have in here, they pointed for reasons for the back pain and made the first explanations I had heard about what was really happening. It turns out that the majority of your back pain is due to muscle spasm. Your muscles in your back start tightening up, and the pain gets more progressive and worse. That is what we see in everyday practice. The lady that I'm talking to about, she learned also that most of these muscle spasms were associated with what are called trigger points. What are trigger points? They are points in the muscles in your back and other areas. She studied all areas of the body where if you go and you touch with your fingers, the physician or anybody, you get to a certain point and you hit that little point, bam, it triggers the pain. That's why it's called trigger point. And the pain is horrible where you touch, but it spreads to other areas. So she made all these charts showing where the pain from different muscles spreads to. So you can have pain like even going down your back or your leg or wherever, yet it originates someplace else, the trigger point. Then I went and I looked for help. I went to an orthopedic surgeon who taught me how to treat trigger points. It was very good of him for letting me do that. So I started again learning how to identify trigger points and treat them. And guess what? My patients got relief. And when pain is so severe, they really appreciate, because this pain is horrible. Everybody that talks to me about this pain says it's the worst type of pain they ever had. Women say having childbirth is nothing compared to this pain, and it is true. Or breaking a bone, or surgery. Forget about it. This is horrible. and it is chronic back pain. The pain keeps getting worse. Therefore, a lot of people who have this type of pain, it's associated with depression because pain is horrible. Now, depression and stress also may be the cause of the back pain. They seem to be mixed together. But anyway, at least I had something. I had the trigger points that I could treat and give patients relief. Hey, at least I could do something. But there was a problem. The injections only give temporary relief. Other medications do not work. Other medications are actually dangerous. You don't use opioids for this back pain. Opioids are medicines, that are like opium. They're controlled medications. They'll take care of pain, yeah, but then you got to keep going and taking more and more and more, and you can get addicted. It's dangerous. I won't go into that. That's a whole different story. But then the problem I still had was, even though I could relieve it, I couldn't cure it. So something interesting happened. Years passed, and somebody developed back pain. I developed back pain. And guess what? I could tell by stretching and going like that. And it was myofascial pain syndrome, the same thing. Also, there is a lot of discussion whether fibromyalgia and myofascial pain syndrome are the same. For me, they're very, very, very similar. And basically, I treat them the same way. Now, I went to every pain specialist and doctor I could find trying to get relief, and I did exercise and swimming, and I got massage. By the way, massage therapists, they're the ones who know the most about your back. They are taught of anatomy, and then when they massage you, they feel your muscles. So they know a lot more, the people who are trained in massage therapy. But anyway, nothing seemed to work. At the end, I kept getting worse and worse pain. So what did I do? Guess what? I went back to my friend, NIH, and I researched. And I found 2 doctors that reported that lithium took away back pain of the muscle spasm type that I've been talking about. So I just went to my local pharmacy, got a few lithium pills. And guess what? 3 days, there was no pain. And that was over 5, 6, 7, 8 years ago. I have never had pain again. My massage therapist that I went to couldn't believe it. I couldn't believe it, but it was true. So with that information in hand, I did 2 things. I started treating my patients with lithium for the fibromyalgia and for the spasms. Guess what? Same results. Mostly everybody got better, fast and cheap. And they were happy. And I still follow them up. I always ask them if I had more back pain and so on and so on and so on, when they come in for other reasons or whatever. But I didn't do a study. I have to repeat, this is not a study. These are just my patients walking in the door. But I knew I had to do for them what I did for myself. I had to be a doctor. I was taking care of their back pain, and it was working. And some people told other people, and whatever. That's the way it usually happens. So it didn't take care of everybody. This is specifically, I want to tell you, people who are on narcotics, their pain then doesn't go away. They're hooked on the narcotics. If you have many surgeries in your back, guess what? The prognosis gets worse, many times more than better. So not everybody, but a large amount of people got better. So that's what I have to tell you about this amazing lithium, and the amazing iron. That's what it's being called in the professional scientific literature. There's all these things. The amazing iron, the amazing lithium. That's what it's being called by top scientists in the world. Yet, guess what? Doctors don't know about it. And it hasn't been approved officially by the FDA for many things for which it could be approved and would help people tremendously. So I'll end up with that. God bless you. Until next time. And see you later, alligator, and a wild crocodile. Bye-bye, and God bless you.